to the House Calls After Show, where our health experts take more time answering your life changing and real questions. Hi, I'm Dia Smith Taylor. Thank you for spending more time with us, Dr. Sanchez, because there were so many pressing questions that people had to ask.
Pleased to be with you.
One question that we had was about pre existing conditions in the midst of COVID. Jason from Texas asks, cities are opening up. Is it safe for me to go to my gym if I have a pre-existing condition?
That's a really, really great question. I think the question to ask yourself about going to a gym is, does the gym have all the things that it should have to protect me and others who use the gym? So if you go in advance, before you go to work out, check it out. Do they have signage about 6 feet of distance between people, at least? Do they have ways for you to wash your hands very, very often? Do they require that you wear a face mask while you are out and about, at least until you get to the equipment that you might use? And is the equipment spaced in such a way that if people are walking around, you're not infecting them, they're not infecting you? So I think the question to ask yourself is, what is the gym doing to protect me and patrons and actually staff as well? Staff should all be wearing masks to the degree that they might be interacting. What have they done to minimize the physical contact between people and made physical distancing more possible?
Yeah, that's a real question. I think we're all dealing with, those same questions because everybody is picking up weight during this pandemic. And so we're looking for opportunities to work out. This next question is about retesting. So Sylvia from California, she's an RN, and she wants to know, I've had body aches, fever chills since the end of May, and I've tested positive for COVID-19 on June 6th. I feel better now. So when is the right time to get retested for COVID-19?
It's been several weeks. I think it's a good time to get several weeks and feeling better. I think it's a good time. It's an important time to get retested. The testing and retesting is absolutely still a work in progress. Remember, there was no COVID-19 in early December 2019. We've only begun to understand COVID-19. But I think the questioner is asking the right question, having been tested positive, having had symptoms, having recovered for a while. Is it time to get retested? I would say yes. Check with your healthcare provider to make that happen.
So this next question is about heart disease, which is right up our alley. Sybil says, should I be concerned as a woman with heart disease about getting tested for the virus? I don't have any symptoms and wear a mask everywhere I go. Also, should I be concerned about my 3 grandchildren, particularly the youngest, who is only a year and a half old?
You asked it as a 2-part question. I'm breaking it up into 3. So as an individual, getting tested without having symptoms or any reason to believe that you've been exposed is of little value at a personal level. If you are in a community where your health department is trying to figure out how much COVID activity there is in the community, knowing that there are people who test negative from a public health perspective has some value, because then in a public health way, you can know how much activity there is or isn't. So because you have heart disease but have no symptoms, I would say I probably would not go get a test. If your health department was saying, we are trying to get this figured out, if they're doing it in a way where you can be completely 100% safe, then go get a test for public health reasons, not necessarily for individual reasons. The other part of that is about being around your grandchildren. Your grandchildren are probably safe. The question is, where have your grandchildren been and where have your grandchildren's parents been? And is everyone convinced that grandma is going to be very, very safe to be interacting? So the thing to do, the most safe thing to do, is to not see them. But the next level of safety, I would say, is figure out a way to interact with some distancing. So hugging, not a good idea right now. Even just, kissing, absolutely not a good idea right now. But, being in a large room where you can look at each other and yuck it up. If you're more than 12 feet apart, yuck it up. If you're not, keep it on the down low. And then the other thing that I did was I mentioned during house calls that my mother-in-law lives 1.5 miles away, and we are back to, because of the activity that's gone on, we use the phone a lot, we use FaceTime a lot, and I drive by there and wave at her outside the window, or she opens her door, and I stay pretty far away, and we can have a conversation. There are ways to be creative to figure this out. And I trust that the person who asked the question, a grandmother who's motivated to see her grandchildren, and the parents of those children can sit down and figure out a safe way to get it done, thinking about the 3 W's: wash your hands, watch your distance, wear a mask, and the 3 C's: avoid closed places, crowded spaces, and close conversations.
Yeah, well, that's great advice. And the thing about COVID is it really has forced us all to be creative, as you've mentioned. And speaking of yucking it up, this next question is about social distancing in schools, where we know there's a lot of activity and a lot of people are concerned. And I would dare say schools and also summer camp people are concerned about what to do. And so Marcia in Colorado she says, I'm worried about teachers and students returning to crowded classrooms in a month. And like I said, also now during summer school or camp. Can you weigh in about that?
I hate to sound like a broken record, but it all boils down to the same basic principles, and that is the 3 W's and the 3 C's. So when it comes to summer camp, first of all, ask yourself, is that the smartest thing to do right now? Is there the capacity of that camp to do all the things that are going to make it possible for children and counselors to be safe in this time of COVID? That includes the ability to wash your hands a bunch. That includes social distancing and getting that figured out. Is it impossible? Not impossible, but it takes a lot of creativity, and it takes a lot of rigor and a lot of commitment to a certain regimen that may not be the norm, and absolutely wearing masks. And then the other is, again, if a camp situation, how do you avoid closed spaces, crowded places, and closed conversations? And if you can convince yourself, so I think as a parent, you should ask, do you have a plan and can I see it? I'd like to see that plan. And that plan should include what happens if we think somebody has COVID-19, a counselor or one of the campers, and the same for the school. What's your plan? Can I see it? And what is the plan if somebody were to get sick during the school day? I would say to parents, schools should be figuring out how to do staggered shifts, maybe not all students every single day. Have a plan that includes some way of doing some things virtually, using spaces and rooms that aren't ordinarily used, gymnasiums for teaching as opposed to classrooms. But again, I think it's, what's your plan to protect my child? I want to see it, and I want to make sure that at the very least, it complies with what the CDC says, or the things I'm hearing about the 3 W's and the 3 C's somehow contained in that plan.
Dr. Sanchez, believe it or not, I just got a text. The questions continue to come in from our last show. So I really appreciate you taking time out to answer a few more questions. And so Ed Lindley, look, this is a great question, says, my wife makes me change clothes when I come home from grocery shopping. Is that reasonable?
I think changing clothes when you've been grocery shopping, unless that grocery store full of people coughing all over you, is a little over the top. So I would say that the reasonable thing to expect that somebody do when they've gone grocery shopping right now, given what we know, is to come inside and wash hands. And in fact, what I do when I carry a little bottle of soapy water, a little bottle of water, and a little bottle of, and a towel. And I wash my hands with soap and water. Soap and water works a little bit better than the hand sanitizers, but if you can't have that, have the hand sanitizer in your car. And every time you come in from being somewhere, use it. And then when you walk in your house, use it again. Way better than having to change your clothes. And I can only imagine what the laundry load is if that is what's happening every time you step out.
It's overwhelming, to know what to do, what not to do.
Absolutely.
When you touch a door, when you, how many times should you wash your hands? It's overwhelming for so many people. And there are so many misconceptions. And so Patricia, speaking of misconceptions, says, once you've had COVID-19, you can't get it again. It's a virus, just as a flu or a cold. That's what she says. She said you can get it again, right?
Here's what we know, which is that we don't know. The truth is there hasn't been enough time for us to be sure. And what I hear the experts say is that there is probably some protection from being reinfected, but that protection is not a lifelong protection. And so what's not clear is whether that protection is months, a few months, many months, or years, if that. So I wouldn't say all bets are off. It is likely that you have some degree of protection, but we're not sure how much or for how long. And the better part of valor, I believe right now, is to act as if you have no protection, rather than valiantly and cavalierly step out and act as if you are a super protected person, and maybe role model the wrong behavior. Because if you think you're protected, then you don't, and you can't get it, then you might think you can't give it, and you're not going to wear a mask, you're not going to do the things to take care of yourself. Really bad. I'm a believer that we should all be modeling the behavior that we would like others to engage in. So I, as I've shown before, am wearing a mask everywhere I go. I wash my hands as I described earlier, and I make almost a dramatic point of steering clear of people if I'm going to become 6 feet from them. I want them to be aware of where I am, and I want a message to them that the message is we need to be 6 feet apart. I don't yell at people. I don't get into fights with people. I just do my part to stay 6 feet or more away.
Nice mask, by the way.
Thank you. It was. It came to me from the American Heart Association. I spoke in Louisville, Kentucky, and so interestingly, just for folks who might be seeing this, it's AHA on this side and the state of Kentucky with a flag on the inside. So this is probably the best after speech gift I've ever gotten. Beats the heck out of a plaque. I can put it on my face and protect myself and others.
And use it.
And use it.
Yeah, unlike plaques sometimes. So just 2 more questions, not because we don't have more, just because there's so many questions. And I particularly like this question because a lot of us want to go back and get certain services done, especially women, and for self-care purposes even. And so this question asks, should the massage therapist wear both a mask and a shield?
Common sense is really important. It is probably the case that every little thing you add adds another layer of protection. We did talk about face shields and did say that if you're going to be, I did say this, if you're going to be in a contained space for a prolonged period of time and exposed to somebody, particularly if you are the person who's providing the service, I would prefer to go somewhere where somebody's wearing a mask and a shield. That's probably going to reduce the likelihood that they will infect me if they are an asymptomatic carrier. Now, that's also assuming that you yourself are really, really, really sure that you're not an asymptomatic carrier, and you should afford that person who's doing the massage the same level of respect and care. Doesn't mean you need to wear a shield necessarily, but you should be wearing a mask if there's going to be that kind of exposure. Again, every little bit that might make a difference. It's certainly not going to hurt. So as I said with the camps, as I said about the gyms, as I said about school, I will say about masseuses and massage therapy locations. I'll also say this about any place you go. What is that place doing to reduce the risk that I might get infected in that place? That's a critical thing to think about anytime you go anywhere in this time of COVID. Last thing about that, I would say, just a reminder for July 4th weekend, things outside are better than things inside pretty much across the board. Doesn't mean you can be closer. It just means that if you do all the things that we're talking about, you reduce your risk. That is the 3 W's and the 3 C's. You reduce your risk way more than if you do exactly the same things inside, because inside stuff doesn't move the way it moves outdoors.
Listen, you've been so gracious. Clearly, there is no limit to the questions that people have, which means this service that you've been giving us is just invaluable. And thank you so much for joining us for our first after show of House Calls. It's been amazing. You've been amazing. And I have a feeling we'll be doing more of this. So we appreciate you, and we encourage everyone to make sure you tune in on every Monday. And we'll continue to bring you after shows and information from our experts that will hopefully change your life and help you to live a healthier one. I'm Dia Smith-Taylor, and we appreciate you so much, Dr. Sanchez.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.